Hello, my name is Lauren Miller. My path to medicine has been a little unique. I started off by pursuing a bachelor's of science in clinical laboratory science at Marquette University in Milwaukee, Wisconsin, before immediately going to medical school at the Medical College of Wisconsin. However, in the middle of my training, I decided to actually make my MD into a dual degree program. And so I attended Loyola University Chicago to complete a Master of Jurisprudence in Health Law with a certificate in compliance studies, and then returned to MCW to finish my medical degree. Recently, I completed residency in anatomic and clinical pathology at the University of Michigan, and I'll be pursuing transfusion medicine fellowship next. I'm so passionate about how the healthcare system interoperates. And so part of that is inspiring the next generation of physicians. So as a pathologist, I have a pretty unique perspective where I don't see patients 98% of the time. However, I work really closely with my patient-facing colleagues who practice different specialties in medicine. And so being able to see medicine from both having the experience in medical school where I saw patients like many specialties that you'll become familiar with, whereas now in residency, I practice in a bit of a different spectrum. I really want to take all of the knowledge and skills that I've gained and pass it on to the next generation of students. I have been successful, thankfully, with help from my mentors and different folks along the way. And so I really hope to pass that back to my students through coaching. My journey through medical school and into residency has really been enriched by the ability to be involved in multiple different professional organizations at varying levels of leadership roles. I've been fortunate recently to serve on the Commission for Science, Technology, and Policy with the American Society of Clinical Pathology, and I was recently appointed to the Biotherapies Leadership Committee with the Association for the Advancement of Blood and Biotherapies. In medical school, I had a wonderful time serving as co-president of the MCW chapter of the American Medical Association Medical Student Section, as well as the American Medical Women's Association. And I even was able to start a pathology and laboratory medicine interest group to share my passion for pathology with others. My work has fortunately gained me some notoriety. I was recognized as a 2023 40 Under 40 by the American Society of Clinical Pathology. I received the 2024 Dr. Philip and Sandra Barney Resident Volunteer of the Year Award, also from the American Society of Clinical Pathology, as well as travel awards to be able to attend professional society meetings throughout multiple different societies within pathology. I think the key to success to medical school is really to find what works for you. There's no one right way to apply or get into medical school. There's no one right way to be a medical student. There's no one right way to study, and there's no one right specialty that you have to go into and decide to pursue. So my approach to consulting is really trying to figure out what my clients truly value. What is the core root of how they interact with the world? Do they want to be able to go on global health missions? Do they really want to be able to serve in rural or underserved communities? Are they really passionate about a specific area of the body, like the brain or the gastrointestinal tract? All of those factors go into shaping who they are and how they approach both their undergraduate studies as well as medical school. So being true to yourself and relying on your study skills and knowing what works for you without comparing yourself to others is really the key to thrive and not only just succeed in medical school. What is unique about my approach to medical school consulting is that I think of myself as a bit of a chameleon. Not that I can change my colors, but more so that I can change my approaches to adapt to my students. I've worked with a number of students throughout the years, both consulting for medical school applications as well as residency, and no one person needs the same exact guidance as another. So my approach is to first get to know my student as well as I can. I really want to know how they think, what they value, the ins and outs of where they are at currently in their journey, and then where they want to go. And so being able to identify my students' strengths and weaknesses helps me respond to them the best I can as their consultant and really tailor my approach to what they need the best. I would describe my greatest strength as a consultant in two ways. First is that I've taken a unique approach to medicine. I am a first generation medical student. Most of my family had not even completed bachelor's degrees, much less going to graduate school. And so I've navigated the system without a strong foundation and learning as I go with the help from mentors and guiders who have really helped me along the way. Furthermore, I practice in a very unique field of medicine that is not really well understood by medical students or even practicing physicians. But I attended medical school just like everyone else, so I have the benefit of understanding the very standard specialties like internal medicine, family medicine, while also practicing from such a unique perspective where I don't see my patients most of the time. And so I can really help students navigate the unexpected turns in their journey. I mean, I decided as a second year medical student to go pursue a second degree and navigated that process as well. So I really know what it's like to have different twists and turns throughout your path and to take the punches as they come. Secondly is my passion. I have been so blessed by the mentors and coaches and counselors who have really helped shape my career into a successful one. And without those individuals inspiring me, I really don't know if I would have been able to say with full sincerity that I am so proud of myself and where I've gotten to. So I want to give that knowledge back to students because I understand it's a tough process. It can be really hard to navigate. It can be unknown for a lot of people, especially if you don't have someone to rely on. And so I hope to be that person for my students and really help them grow into who they need to become to be the most successful.